Hey guys, welcome back to another video. For those of you who don't know me, my name is Lasite. I'm a fifth-year medical student currently studying medicine at KDU. So let me tell you a little bit about where I've been for the past 2 months because I haven't been uploading anything in this channel. So today I got finally an opportunity to record something for you guys. Because of the whole election that is happening here in Sri Lanka. They put a curfew in place, which means that I get half a day off. So I thought, let me make this quick video for you guys. So I officially started my 5th year 4 weeks ago. Now I know that I've been telling you guys for quite a few previous videos that I made that I'm 5th year. Officially I'm 5th year now, but I've been a 5th year for a long time, and that's because of the delays that have accumulated due to COVID, which meant that some of our seniors, previous all the batches have not been able to complete the clinical appointments. And one of the differences that you'll see here in Sri Lanka compared to other universities is that even though there is a backlog of clinical appointments you haven't completed, you must complete those in order to get your degree. I know, for example, my sister who's studying at Imperial College, they skipped on some appointments in order to keep up with the pace. Obviously, that's not something that is being done here in Sri Lanka, so they don't care about that. So even if there's a backlog, 1 or 2 years, they don't care. They would still want you to do those appointments and finish up your degree the same way you would have done if the delay were not there. So yeah, I officially started my 5th year. Now it's been 4 weeks. Today is Sundays, which basically is the last day of the 4th week. And let me tell you what I've been up to so far. So in 5th year, you have to do 5 subjects: surgery, medicine, gyn and obs, pediatrics, psychiatry. We started with surgery. Our batch has about 85 students, and they have been divided into 3 groups. Us, surgery, another group for medicine, another group for psychiatry. Okay, so there are 29 of us doing surgery at the moment, and each appointment is 2 months long. So that means 10 months of appointments for the 5 subjects, with 1 month of study leave and 1 month where you're going to be assessed on those subjects, so the final year exams essentially. So start talking about surgery now. Each subject has different timings, different rules, so this applies only for surgery. The official times for surgery is from 8 a.m. to 8 p.m. and you have to come every single day. It doesn't matter if it's a Saturday or a Sunday, public holiday. Every single day of the appointment for 8 weeks you have to come. There is no rest in between. You don't get days off. Every single day, 8 a.m. to 8 p.m. you have to be here for 8 weeks. Okay, so that, if my math's not wrong, that's accumulates to 56 days, active days that you have to be here in the world. So now today, obviously, it's a huge exception. It's one of a kind, where because of the election happening and the curfew that's been put in place, I get to stay home. Otherwise, at this time I would be in the hospital. Okay, so those are generally the rules for this appointment, and one thing to consider is that these are just the official times, but we live here in Sri Lanka. We don't live on official rules. There's always something behind the official stuff. So we start around 6 o'clock in the morning because we don't have enough time to cover all the patients if we come at 8 a.m. and the consultants usually come 8:30, 9, so that doesn't give us enough time to cover all the patients, so we have to come earlier than that. And we don't finish by 8 p.m. mostly. Sometimes we go up to 9, 10, and there are some group of students called the shadow HOs, which have to stay there for 24/7. So I'm going to touch on that point right now. Every single week, there is a group of 4 students that is going to act as shadow HOs, which basically means that you're going to be shadowing the HOs. You're acting as HOs, not officially obviously, and you're supposed to look after all the patients that come to the ward. So in the ward we have about 70 beds, So if those 70 beds fill up, which usually they do, those 4 students are responsible for all the 70 patients in the ward. So obviously we divided them among ourselves, so to reduce the the flow of patients, because realistically we are still not able to look after that many patients, even though if once you graduate as an HO, you are supposed to look after those 70 patients yourself. If you go to a periphery hospital, for instance, you might be the only HO in the ward and you're supposed to look after all of those patients. So that's why for us to get the experience, our consultants have decided to do this shadow HO period of 1 week, where we get to experience this, so that by the time we finish our MBBS degree, it's not something new, something that we have already experienced, and we are ready, to take on the job. So that's something that we do, and officially for me will be this week. So this coming week from tomorrow, that's my shadow week. So I'm supposed to be there 24/7 for 7 days. Now the question that you might be asking is, if you're supposed to be there 24/7, how do we get to go back home, or how do we shower and things like that? So the reality is, you can go back home for an hour or so just to change, do anything that you have to do, and then you have to come back to the ward. That's officially what's supposed to be like. Obviously that doesn't happen, certain students don't do that, they finish by 10-11, they go back home and then come back early in the morning. So that's doable, but the reality is, if there are patients coming in later at night, 1 a.m., 2 a.m., and you're not there, you haven't seen the management that has been on those patients, then you might end up in trouble, because then the consultants might ask from you what has been done. If you're not able to answer confidently, then that raises an issue of whether you've been there overnight or not. And that has happened to a few of us recently. So yeah, those are things that, a little bit unavoidable. Okay, so let me just touch on a few points for you guys, especially for those of you who are thinking to come here to study medicine. Now, one of the things is that you have to realize this degree has a lot of exams. Almost every year you have exams that you need to complete. First and second year you have anatomy, physiology, biochemistry. After third year and fourth year, you do microbiology, parasitology, pathology, pharmacology, etc. And you need to pass those exams, and you're going to be given a grade for those. But the most important exam is your final MBBS exam that you're going to be sitting in 5th year, because it doesn't matter what grades you end up getting in the previous subjects during the first 4 years. The 5th year exam is the most important exam. Your entire degree, the class that you're going to be getting, if it's a pass, a merit, or distinctions, or if you want to say 2-1, 2-2, or first class, depend only on the final MBBS exam. And because it only depends on that exam, what that means is that every subject that you've been studying from first year till now is going to be assessed in your final MBBS exam. So for surgery, they're going to be assessing your anatomy, a certain degree of physiology, pathology, pharmacology, together obviously with the surgery subject per se. So for those of you who are planning to come here, that's something you want to think of, because you need to know everything from the point you started in order to be successful in that subject. And a lot of people fail because they are not able to recollect their anatomy or their pharmacology, for instance. So that's different in other countries. Like in the UK, once you pass the, let's say, anatomy, you're not going to be assessed on anatomy again during 5th year, at least not predominantly. There will be certain degree of anatomy that you're going to be assessed on, but it's not as important for you to pass your 5th year subjects. Okay, but here, if you don't know your anatomy, it's going to have a huge devastating effect towards your final grade in surgery, for instance. Okay, so if you have the possibility to choose a university, those are the things that you want to look at. Obviously, financial capabilities is something, and the course structure, those are things that you want to focus on. And I know now there hasn't been any videos so far about KDU, about fifth year, so that's why I'm making this video, so that you guys can get an overall picture of what it means to be, you know, a student here at KDU, and what are the challenges that you need to face. So this is obviously one of them. And then obviously the long periods of hours that you need to do. So those are the things that you need to consider. The other thing is, actually this is a positive, I would say, is, let's say that you're now facing all of these issues. What does that mean in the long run? In the long run, it means that once you come out as an MBBS graduate from KDU and you go back to your respective country, or whether if you're, you know, from Sri Lanka itself, you're coming out being a really knowledgeable doctor who knows their anatomy, that knows the, you know, the basic subjects, the basic sciences that a graduate in medicine is supposed to know, which makes your life easier later on when you want to apply to, you know, to do further specializations and so on. But it also means that you're going to be a better doctor, and you'll be able to look after your patients much better than, you know, a doctor maybe graduated from a different country. Okay, so that's one of, you know, the advantages, I suppose, of being here at KDU. And, you know, if you have the option to choose, those are the things that you want to focus on. Okay, yes, KDU being here in Sri Lanka gives you more exposure to patients, because usually in countries like the UK, you have to ask for permission. You know, you need to get consent from the patients in order to talk to them and get their histories and examinations, which is not something that happens here. The moment you approach a patient, you can straight away start discussion with them about their examination, you know, about their history, why they came to the hospital. It's like the consent is given to you the moment you approach the patient. In the past 3 years that I've been doing clinical appointments, I've only been rejected once by a patient who felt uncomfortable to speak with me because of the condition that the patient had. But then eventually, after a little bit of time, by talking to them, you know, just have a couple of minutes discussion, they opened up, and even that patient ended up speaking with me. So that means I had 100% success rate of speaking with patients, which doesn't happen in other countries. I know my sister, she's in the UK, she's recently graduated from medicine, and they don't get this opportunity. They don't get to speak to patients the same way that we do, and they get more rejections than actually getting consents. So that's something. And, you know, examinations, for example, we get to examine patients, almost every patient that we speak with. And, you know, we do DREs, for instance, digital rectal examinations, which a lot of patients in the UK would reject you from doing, even though you're a medical student and you're there to assess them, to learn out of that digital examination. You still get rejected. But here that doesn't happen. You can literally do anything, and the patients trust you as a doctor. Or, you know, one of the things that I get told every time is, oh, you are learning to become a doctor in the future, you are the one who's going to be looking after us, so I'm going to give you the consent to do this, to talk with me and do the examinations that you're supposed to do. You know, it's a privilege which you don't get elsewhere. So yeah, my advice for you guys are, before you choose a university, take these things into consideration. Okay, the course structure, and also university life is another very important aspect. Here you don't get much of a university life. I can tell you that because I've been a biomedical science student, masters in the UK. I've interacted with a lot of medical students in the UK. My sister is also doctor product of a university in the UK. So I can tell you, we have very different lifestyles. We don't get a university lifestyle here, to be honest. You get so much better lifestyle going to a university in Europe. So if that's important to you, then maybe a university out there would be better than coming here in Sri Lanka. But if you want to have a well-rounded education, both in practical work and being theoretical knowledge, then coming here to Sri Lanka would be a better experience for you. But the reality is also that if you were to study in a university in Europe, maybe you will lack on those skills initially, but you can quickly grasp those later on while you do your internship and you study for postgraduate examinations. Eventually you're also going to get that experience. Maybe not as fast as we get it right now here at KDU or other universities in Sri Lanka, but at the end of the day, you will get that exposure. And one of the things I'm being asked every time is, are you planning to do your internship here in Sri Lanka? My answer is no, I'm not going to be doing it here, because working here in Sri Lanka is not that easy. You have, as an HO, you have to do 24/7 hours, you have to be in the ward, the pay is not as great. So why would I want to face such a situation? Why would I want to willingly put myself in a position like that when I can go back to the UK and work in a much better environment? Okay, so by doing that, I'm going to obviously have a less exposure. I'm not going to be looking at that many patients. Maybe as I would look over here, I'll be in charge of less patients. Like I said earlier, you might be the only HO in a ward looking after maybe 50-60 patients in Sri Lanka, while in the UK there's a different situation. You'll be looking after maybe 10 or 15 patients at a time. So you can see the difference. The exposure that you're going to get is much lower. But like I said, eventually you're going to get the same place. You're going to have the same knowledge as a doctor in Sri Lanka over time. Okay? And that is okay. You're not supposed to know everything by the time you become a graduate, an MBBS graduate going to your internship. I suppose for doctors and other medical students watching this video, they might have their own opinion. If you do, feel free to leave your comments down below. But from my perspective, that's my advice for you guys. Think about this stuff, because these are things that you should be thinking of if you want to study medicine at a university. These are the things you should consider. So having said that, I hope that you guys grasped something from this video. And I just want to touch on maybe just one more point for you guys, and that's basically on the amount of stuff that we are supposed to be looking at in order to prepare for our examinations. So one thing that I didn't mention is how our exams are structured for our final year. So at the end of each appointment, we have an OSCE and we have a Viva. The Viva essentially is a interrogation essentially with two consultants that will be asking us questions, mostly on instruments used in the ward or management plans for certain emergencies, like if you get an intestinal obstruction, how would you manage that patient? So that's done over a period of 15 minutes, where 7.5 minutes are done for cases like intestinal obstruction, appendicitis, and so on, and you have to explain the management. And now there's, for example, another 7.5 minutes, so 7.5 minutes for instruments, maybe surgical instruments or catheters. How do you place a catheter? What are the parts of the catheter? What are the different catheters? Do you know NG tubes, which is basically nasogastric tubes? How do they work? What are they used for? When do you not put them? So those are things that are assessed at the end of our appointment. And then with that, there is also NOSCI, which is basically a live station exam. There's going to be some live stations. They might be putting bottles like of normal saline, and then we'll have to talk about the indication, what's the usage of the bottle, what are the components that make the normal saline, so things like that. Or maybe a live station where you'll have to speak with the patient and give them advice post-operatively for someone, for example, who's done a hernia, and what the advices that you would give them for before going home. So things like that. Those are obviously just a few examples, but obviously it gets more complicated than that. So we do that, and then at the end of the year, once you complete all the appointments, you'll be sitting for the MCQ paper, SCQ, and for long cases and short cases. So I'm not going to expand on long and short cases right now, but those essentially are the components that we have for each subject that we are going to be doing here now in 5th year. Alright, so that gives an overall view of 5th year and about surgery and the things that you need to consider before coming to Sri Lanka if you want to study here at KDU. Because what the reality is, you need to enjoy the course that you're doing. It's not just about studying medicine. Getting into medicine is one fight. The other fight is surviving at the university. And you're not going to do that unless you like the university you're in, the course that you're studying. Is it the way that you want to study? Or because there are tons of universities that offer medicine at different levels, using different educational methods. So you want to find out which one is the best for you if you want to study medicine. So obviously, for someone who doesn't have that many options, is financially constrained, then obviously you have to choose medicine among the universities that you're able to go to. So that narrows down your possibilities. But obviously, if you have the vast amount of different universities that you can attend, then I would say consider these things. In my case, I didn't have much option, so I had to come here to Sri Lanka, and I came here not knowing anything about the course. But irrespective of that, I would say even if I had the same knowledge I had now, I would still come next year to study medicine, because that's what I wanted to do, and I had no other option open to myself, so I had to come here. Okay. Having said that, if you guys have any questions, please drop them in the comment section down below, and I'll answer them as soon as possible. Like I said, now this year it's very complicated. Finding time, it's one of the most difficult aspects of this professorial appointment. So I'll try my best, obviously, to get back to you guys as soon as possible. And having said that, I'll see you guys in the next video. Bye for now.